Hi, I'm Dr. Suzanne Cziraki, and today I'm going to be placing a TAD, a temporary anchor device, made by Vector. And Terry is going to allow us to film him today for the placement. I'm going to be placing it in his upper left back area near the second bicuspid tooth. And the reason we're doing that is to shift Terry's upper teeth to the left, to center them with the middle of his facial plane. Terry's wearing Invisalign, upper and lower, and he's on his number 10 aligner out of 30. We're going to be closing the extraction space where his tooth was removed. We're going to use the TAD to help us move the teeth. So right now I'm going to put in some local anesthetic, and I've just got some topical anesthetic in the area. I'm going to leave that there for a few minutes. Here I'm using the Vector system for the temporary anchor device, which is a mini screw titanium implant, and I'm going to use an 8mm TAD for Terry today, and I'll show you later how I'm going to place that. This is the handle, the driver that I'm going to use to place the TAD. Alright, so we're going to place the freezing. And I'm going to just hold your lip up, Terry. Just open your mouth a tiny bit for me. Good. And we're just going to put a little, you're just going to feel me tugging on your lip. Doing great. So I'm going to just infiltrate some local anesthetic into the area. And we'll get profound anesthesia in this area of the alveolar bone. Was that your stomach? Man, I'm going to need you to get the suction here. Sure. Okay, so this is our TAD, the temporary anchor device. So I'm using the 8mm length and the 1.4mm diameter. And this is for the bicuspid area. It's a little titanium screw. And I'm going to now place it into the alveolar bone, mesial to the upper left second bicuspid. Okay. Okay, Terry, I'm going to push now. How are you doing? Okay, just feeling the pressure. So we want to turn it until the tissue blanches, and then we're just going to do it for the... So I'm going to have a look at it, and I'm not done. So I check and I look for the base, and it could be a little closer to the gingiva, to the mucosa. So I'm going to just put it in a little bit further. A few more twists, Terry. I'm almost done. So that looks good. We want the base of the implant to be flush with the tissue. So there it is. Fabulous. How does that feel, Terry? Okay? Great. And there's the bottom one. Excellent. Okay, great. So now we have both the lower and the upper Invisalign in place, and we just get you to bite together there, Terry, and turn way over this way, and we can see now we've got our new TAD. We've got a little ceramic button placed on the gingival aspect of the upper left canine tooth, and so what we're going to do is get Terry to wear a removable elastic to help with the shifting of the upper anterior teeth to the left to center his midline. So we're going to just put the elastic over our new TAD and onto our little ceramic crystal there. And also, he can back that up with with another elastic that can just go from a hook that we placed on the permanent molar, again, to this eye tooth. So we'll have 2 elastics running. And in addition to that, we'll also run a class 2 elastic. And I'll show you that as well. That's too small, though. I need the Japan. So we're going to also have Terry wear this, what I call the class 2 elastic. Yeah, just open actually, Terry. That shows really great. So now we have our TAD coming to the crystal and the crystal down to the first lower molar. And bite together, Terry. So if we look carefully here, we'll see the center of his lower front teeth is here, and the center. So we're off almost the width of a full tooth. So our goal is to shift all the upper dentition over to the left using the space we created by removing his first bicuspid tooth. And I'm using this TAD as an anchor so that we'll get absolute tooth movement to the left. Great. Well, that's wonderful.